As a medical professional, I have learned one important truth over the years. Many health problems in older age begin not with disease, but with neglect of basic body care. Cleaning the body is not a cosmetic habit, it is a medical necessity, especially for seniors. With age, immunity weakens, skin becomes sensitive. Circulation slows, and infections take longer to heal. That is why the right way of cleaning the body becomes critically important. Let me share 6 key health principles every senior should understand and follow. As the body ages, the skin undergoes significant changes that require special medical attention. Aging skin becomes thinner, more fragile, and loses its natural oils much faster than younger skin. Because of this, aggressive scrubbing, rough loofahs, strong chemical soaps can cause microscopic injuries that are often not visible but weaken the skin's natural protective barrier. When this barrier is damaged, bacteria, fungi, and allergens can easily enter, leading to infections, rashes, itching, and slow-healing wounds, which are especially dangerous for seniors. From a medical perspective, cleanliness should never mean harshness. Gentle cleaning is essential to preserve the skin's natural defenses. Lukewarm water is always safer than hot water, as excessive heat strips away essential oils and increases dryness. Mild, fragrance-free cleansers help remove dirt and sweat without disturbing the skin's natural balance. Products designed for sensitive or mature skin are not luxury items. They are a medical necessity for older adults. Another important aspect of gentle cleaning is the method used. The skin should be washed using soft hands or a clean, smooth cloth, avoiding pressure and repeated rubbing. After washing, the skin must be patted dry rather than rubbed, as friction can cause small tears. Applying a light, doctor-recommended moisturizer immediately after bathing helps lock in moisture and reduces cracking, which is a common entry point for infections. Neglecting gentle skincare can lead to chronic dryness, eczema, frequent itching, and open sores that may become infected. These conditions often result in unnecessary discomfort, sleep disturbance, and repeated medical visits. When seniors adopt gentle cleaning habits, they protect their skin, reduce health risks, and maintain comfort, dignity, and independence as they age. As people grow older, the body's ability to fight germs naturally becomes weaker, making infections more common and more dangerous. Regular hygiene plays a critical medical role in protecting seniors from these risks. Many infections do not begin as serious illnesses. They start quietly on unclean skin, in moist areas, or in places that are often ignored during daily cleaning. Without proper hygiene, bacteria and fungi multiply rapidly, especially in warm skin folds, between the toes, under the arms, and around private areas. From a medical standpoint, daily hygiene is one of the simplest and most effective ways to prevent infections before they begin. Cleaning the body removes sweat, dead skin cells, and microorganisms that can trigger fungal infections. Skin ulcers, urinary tract infections, and even bloodstream infections in vulnerable elders. For seniors with diabetes, poor circulation, or limited mobility, the risk is even higher because small skin problems heal slowly and can quickly become serious. Drying the body properly after washing is just as important as cleaning itself. Moisture trapped in skin folds creates an ideal environment for fungal growth. Clean towels, personal hygiene items, and fresh clothing should always be used, as shared or damp items often carry germs. Regular washing of feet, careful trimming of nails, and maintaining clean undergarments are essential habits that significantly reduce infection risk. Neglecting hygiene does not only cause discomfort such as itching or odor, it can lead to painful infections that require long-term treatment, antibiotics, or hospitalization. Regular hygiene supports the immune system by reducing the daily germ burden on the body. When seniors maintain consistent and careful cleanliness, they protect themselves from preventable infections, preserve their health, and maintain a better quality of life with fewer medical complications. Many seniors believe that bathing more frequently will automatically improve health. But medically, excessive bathing can be harmful to the aging body. As the skin ages, it produces less natural oil, which is essential for maintaining moisture and protecting against external irritants. Frequent bathing, especially with hot water and strong soaps, removes these natural oils repeatedly, leaving the skin dry, fragile, and vulnerable to damage. This dryness often leads to itching, cracking, and inflammation, which can become entry points for bacteria and infections. From a clinical perspective, overbathing disrupts the skin's natural balance. The skin hosts beneficial microorganisms that help protect against harmful germs. Washing too often can disturb this protective ecosystem, increasing the risk of rashes, fungal infections, and allergic reactions. Seniors often experience worsened conditions such as eczema, dermatitis, and chronic dryness when they bathe excessively without medical guidance. Water temperature and duration also play an important role. Long baths and very hot showers weaken the skin barrier and can cause dizziness or sudden drops in blood pressure in older adults. This increases the risk of falls, which are a major health concern for seniors. Short, safe baths with lukewarm water are far more beneficial than prolonged exposure. Medical advice generally supports bathing once daily or on alternate days for most seniors, unless specific medical conditions require otherwise. Spot cleaning of areas prone to sweat or odor can maintain hygiene without harming the skin. Balanced bathing habits preserve skin integrity, reduce irritation, and support overall comfort. Understanding that cleanliness is about quality rather than quantity helps seniors protect their skin, maintain health, and avoid unnecessary medical complications associated with overbathing. Maintaining a clean body does far more than remove dirt. It plays an important role in supporting healthy blood circulation, especially in older adults. As people age, blood flow naturally becomes slower due to reduced vessel elasticity, less physical movement, and chronic health conditions. Proper body cleaning, when done correctly, stimulates the skin and underlying tissues, encouraging better circulation throughout the body. This improved blood flow helps deliver oxygen and nutrients to the skin and muscles, which is essential for tissue health and repair. During bathing, gentle rubbing of the skin using hands or a soft cloth activates nerve endings and small blood vessels near the surface. This mild stimulation acts like a light massage, encouraging blood to move more efficiently, particularly in areas such as the arms, legs, and feet where circulation often weakens with age. For seniors who spend long hours sitting or lying down, this simple daily practice can help reduce stiffness, swelling, and discomfort caused by poor circulation. Better circulation also supports faster healing of minor cuts, pressure marks, and skin irritation. When blood flow improves, the body can respond more quickly to inflammation and repair damaged tissue. This is especially important for seniors with diabetes or vascular problems, where slow circulation can lead to serious complications if wounds do not heal properly. Warm, but not hot, water helps relax muscles and widen blood vessels, further supporting circulation without placing stress on the heart. Following bathing, gentle drying, and the application of moisturizer can continue to stimulate the skin and maintain blood flow. Consistent body cleanliness, combined with careful movements during washing, contributes to improved circulation, reduced muscle tension, and overall physical comfort, supporting healthier aging and better daily functioning. Personal hygiene has a powerful impact not only on physical health, but also on mental and emotional well-being, especially in older adults. As people age, changes in routine, reduced mobility, or health challenges can sometimes lead to neglect of personal care, which may quietly affect self-esteem and emotional balance. Maintaining regular hygiene helps seniors feel refreshed, comfortable, and more in control of their daily lives, which is essential for psychological stability. From a medical and psychological perspective, cleanliness is closely linked to mental clarity and emotional comfort. A clean body reduces physical discomfort such as itching, sweating, or unpleasant odors, which can otherwise cause irritation, restlessness, and poor sleep. When the body feels clean and comfortable, the mind is better able to relax. This sense of freshness often leads to improved mood, reduced anxiety, and a more positive outlook on life. Good hygiene also plays an important role in preserving dignity and self-respect. Seniors who maintain personal cleanliness often feel more confident in social interactions and are more likely to engage with family, friends, and community activities. This social engagement is vital for emotional health and helps reduce feelings of isolation, loneliness, and depression, which are common concerns in later life. Establishing simple hygiene routines provides structure to the day, giving a sense of purpose and normalcy. This routine can be particularly beneficial for seniors experiencing memory changes or emotional stress. The act of self-care sends a positive message to the brain, reinforcing self-worth and independence. Consistent hygiene habits support emotional resilience, improve mental well-being, and contribute to a more balanced and fulfilling life for older adults. As the body ages, the immune system naturally becomes less efficient, making seniors more vulnerable to infections and prolonged illness. Correct hygiene plays a vital role in supporting immune function by reducing the number of harmful microorganisms the body must defend against each day. When hygiene is practiced properly, it lessens the constant burden on the immune system, allowing it to respond more effectively to serious threats rather than being overwhelmed by preventable germs. From a medical viewpoint, the skin is the body's first line of defense. When kept clean and healthy, it acts as a strong barrier against bacteria, viruses, and fungi. Correct hygiene removes harmful pathogens while preserving beneficial skin bacteria that support immune balance. Gentle and regular cleansing prevents the buildup of sweat, dead skin cells, and contaminants that can weaken this protective barrier and trigger inflammation or infection. Hand hygiene is especially important for seniors, as hands frequently come into contact with surfaces carrying germs. Proper washing at key times significantly reduces the risk of respiratory and gastrointestinal infections. Oral hygiene also plays a crucial role, as poor mouth care can allow bacteria to enter the bloodstream and strain the immune system, increasing the risk of systemic illness. Correct hygiene also reduces chronic inflammation caused by repeated minor infections or skin irritation. Lower inflammation allows the immune system to function more efficiently and conserve energy. Seniors who maintain appropriate hygiene routines experience fewer infections, recover faster when illness occurs, and require fewer medical interventions. By supporting the body's natural defenses, correct hygiene becomes a powerful daily practice that strengthens immunity and promotes healthier, more resilient aging. As we come to the end of this discussion, one message stands very clear. True health in later life is built through small, correct daily habits, and proper body hygiene is one of the strongest foundations of healthy aging. Cleaning the body the right way is not about force, frequency, or perfection. It is about understanding the needs of the aging body and responding with care, balance, and awareness. Gentle cleaning protects fragile skin. Regular hygiene prevents infections. Avoiding overbathing preserves the body's natural defenses. Cleanliness supports circulation. Hygiene uplifts mental and emotional well-being. And correct practices strengthen immunity. Together, these habits reduce illness, discomfort, and dependency, while improving confidence, comfort, and quality of life. This is not hidden medical knowledge. These are simple senior secrets that make a powerful difference when followed consistently. For elders, the body carries the history of a lifetime. It deserves respect, patience, and thoughtful care. Proper hygiene is not only self-care, it is self-protection. It reduces hospital visits, lowers the need for medications, and supports independence for as long as possible. Families and caregivers should also understand that helping seniors maintain correct hygiene is an act of prevention. It's not just assistance. Healthy aging does not begin in the hospital. It begins at home, in daily routines, in mindful habits. Clean wisely, clean gently, and clean correctly. When hygiene is practiced with medical understanding, it becomes a silent guardian of health. A clean body supports a stronger immune system, a calmer mind, and a more dignified, comfortable life. This simple discipline, practiced every day, can truly change the way we age.